We haven't talked to Dr. Paul in a week, and I'm glad he's with us today. Welcome to the show.
Thanks a lot.
So, Dr. Paul, we missed you last week. You're a very, very busy man, and we understand. So, we got into stage three a week ago. Talk to me a little bit about that.
Yes, the good thing is that we had the numbers that were sustainable and they were good to go in terms of going to the stage three, which allows more businesses to open, dine-in restaurants and those type of things, which is a good thing. Gyms can open, but one of the things that I think comes with that is sort of I think human nature saying, oh great, everything is open now, everything is good. I think people should know that we're still in a pandemic and stage three is only part of it. We're going to be in stage three for a while. And stage three means that, yes, we can go and have a meal in the restaurant. We can go to the gym. More people can gather. But that doesn't mean that we don't have to follow our previous measures that kept us lower, compared to the rest of Ontario in terms of physical distancing, washing our hands, not going to work or school or out with being sick, and now wearing the masks as well. So I believe that now's the time that we need to really buckle down even more, and respect the distancing. Make sure that even if you're going somewhere where there's like 20, 30 people, which is allowed, depending on the gatherings, that you respect the physical distancing. And if it's indoors, you should be wearing a mask. Obviously, not when you're eating, not when you're exercising. There are some exceptions. So I believe that if we do that all together, we'll be able to, tolerate or, go through the next couple of months because, we will be getting COVID. Look at the worldwide. It's 15 million. United States, it's 4 million. It's across the river, it's all around us. Ottawa had a lot of cases the other day. And by the way, most of the cases that we're seeing are due to people not wearing masks, not physically distancing, getting together with parties, and sort of together close, and then all of a sudden we get 3 or 4 people clusters of these cases. So we're able to control them and contain them, if they flare up here and there. But if a lot of people get sick at the same time, it's not good because we don't want the virus to be in our community. And albeit we're seeing younger people get it, and yes, younger people fortunately don't have a lot of the complications. It goes away in a couple of days, but they can spread it to their parents, the grandparents, or people that have chronic medical conditions. So by wearing the mask and doing the other precautions, we're protecting everybody else. And when everybody else does the precautions, they're protecting us. So the bottom line is let's continue moving forward. Even though that stage three has started, it doesn't mean that we're back to normal. We're going to be like this with restrictions and requirements for physical distancing, washing our hands, and mask wearing for the next couple of months at least until there's a vaccine. But the good news is that we have the capacity to offset any future increases in COVID.
So, locally, Doctor, how are we faring out for our cases locally?
Well, over the last week since I was on here, we've had another 4 or 5 cases added, and we're up to 173 cases. A couple from the SDNG area and from the Cornwall area as well. So it's still around us. It's still in the area. And there were some cases in Akwesasne as well that were published yesterday. So it's really around us. So it's not time to be complacent. I understand people were locked up for a couple of months and they're fatigued, but you know what? Yes, you can go out, have dinner, but make sure that you're socially distancing. Don't go outside of your bubble. If for people in your bubble, you can hug and you can be closer, but if people are outside of your bubble, of those 10 people, that remains the same. Make sure that you can go see them. They can come and see you, sit in the backyard, whatever, but make sure you physically distance. And when you're going to a public space that is indoors, wear your mask.
And I'm going to bring up masks again. You talked about it just briefly here. So it's mandatory now in public places. It's been quite a controversy.
The masks have been a big controversy, but I can tell you that I've had a lot of positive comments about the mask as well. People saying that we're doing something collectively to protect others, the vulnerable ones. And in addition, it's important for us to know that right now, as of today, most of Ontario has a mandatory mask bylaw or directive like we've issued. And as a matter of fact, Quebec, which is our neighbor, has issued it provincially. 90 other countries have done it as well. And there's growing evidence that wearing the mask prevents you from spreading the virus, which we know you can spread even if you don't know you have it. And even if you get sick like today, you may have spread it to me or yourself or others 2 days earlier. So because we don't know when your symptoms will arise, it's important that the masks protect me. If I wear it, you wear it, you protect me. I wear it, it protects you. When everybody else wears it, everybody in the community is protected.
And that's right. And we're all in this together, and we have to do our part. So, Dr. Paul, thank you very much for being with us today and giving us a quick update. We thank you so much. I know how busy you are.
Thank you very much. No problem.